Thank you very much, Greg, for that very kind introduction, and good afternoon to everyone. As Greg mentioned, I'm Dr. Leana Wen, and I'm here to discuss COVID-19 and the future of healthcare, and specifically three sections. First, I want to discuss where we are now in the COVID-19 pandemic and three key lessons that we've learned thus far. I then want to highlight some collaborations between local and state public health and hospitals and healthcare systems. And then I want to talk about the implications for the future of healthcare. So where are we now? As of the time that we are speaking right now, the US is in a very grim place when it comes to coronavirus. We've had already over 220,000 deaths, over 8 million infections in the US, and sometimes we get lost in these numbers. And so I want to tell you about two patients whom to me illustrate some of the effects of COVID-19 that we often do not discuss. My first patient is a woman in her 40s who does not know how she got coronavirus, although she thinks that it's either from her work, or from her husband's. She works at a 7-Eleven. Her husband works in construction, and their entire family has gotten infected. Her mother is still in the hospital. Her uncle, who was living with them, has died. And she has several children. All of them got tested. All of them were infected as well. She herself has recovered from COVID-19, but tells me that she is so tired. She is so exhausted, even weeks after she officially recovered from coronavirus, that she still has trouble getting out of bed. And she has such crushing pain in her joints that she says it feels like all of her bones are being broken all the time. She's unable to work as a result of it. My second patient is a woman in her 70s who has multiple medical conditions, recovered from breast cancer as a survivor, also has chronic medical problems like diabetes and high blood pressure. Because of this and her age, she is too scared to go outside. She hasn't seen her grandchildren in months because they live in different parts of the country. Her kids are essential workers. Her grandkids are in daycare. She knows that she's not going to see them over the holidays either. Now, she is someone who has recovered from depression, has lived with depression, and is recovered from alcoholism in the past, and is really afraid, she tells me, that because of her isolation, that she's going to relapse, because we know that addiction is a disease of isolation. And this is something that also isn't just affecting her. 4 in 10 Americans are reporting that they have had a mental health or substance use issue, also perhaps as a result of this pandemic as well. All of this is to say that there are so many lessons that we have learned, so much tragedy, so much harm that we've seen from COVID-19, and so much that we can still do in preventing this infection from taking over in the months ahead. But we've learned at least 3 key lessons. First, we've learned about the importance of having a national coordinated response. We saw early on, when we don't have enough personal protective equipment, how much not only our healthcare workers, but everybody else also suffered, because we had grocery store clerks, people who worked in nursing homes, bus drivers who died because they didn't have protective equipment. We saw what happens when there is a piecemeal approach rather than a national approach, and we've had to play whack-a-mole across the country, that as soon as you contain viral surge in one part of the country, another part then surges to the point that we have virus hotspots all over the country. That's why a key lesson is the importance of this national coordinated approach. Another key lesson is that public health depends on public trust. And when that trust is eroded, it's very difficult to get it back. And that is also eroded when there is a difference in messaging between our top health officials versus our top elected government officials. It's really critical for messaging to be on the same page, because if it's not, who wins? It's the virus. The third lesson that we've learned in all of this is how COVID-19 has unmasked existing disparities. We know that those who have been hit the hardest by coronavirus are Black Americans, Hispanic Americans, Native Americans, Pacific Islanders, in low-income Americans, those who already face the greatest barriers when it comes to healthcare. And you wonder, well, why is this the case? When we look at a city like mine here in Baltimore, 1 in 3 African Americans live in a food desert compared to 1 in 12 whites. Well, African Americans are also then have a higher rate of having diabetes, heart disease, obesity, these conditions that predispose to severe effects from COVID-19. It's important for us to discuss that it's not the virus in this case that's doing the discriminating. It is our systems. It is the fact that people of color tend to be essential workers who already, for so many people, social distancing is a privilege that not everyone has. And so COVID-19 did not create these disparities, but it has unmasked them. So what do we do? Well, I want to go into my second section, which is talking about collaborations between local, state public health and our healthcare systems and hospitals. Again, something else we've seen in COVID-19 is how much these social determinants of health, how much things like food and housing, these are critical healthcare issues as well. And in this case, I want to take you back to my city too, in Baltimore, and tell you about two of our programs that I ran when I was the health commissioner to illustrate what a difference can be made through the lens of public health. One of our programs was Be More for Healthy Babies, which was a public-private collaboration with over 150 partners in our city. Hospitals, insurers, churches, nonprofit groups were all involved in this one program that had a single goal. And that single goal was to reduce infant mortality. We did this through a combination of approaches like home visiting, providing cribs to low-income women, providing housing, food, and other supports. As a result of this program, within 7 years, we were able to reduce infant mortality in our city by 38%, almost 40% drop in infant mortality. By the way, in this same period, we also cut the disparity between Black and white infant mortality by more than 50%. Another program to quickly highlight is around our work to prevent opioid overdose deaths. In 2015, I issued a blanket prescription for naloxone, or Narcan, the opioid antidote, to every single one of our 620,000 residents in our city. We also did over 30,000 trainings, and as a result of this widespread implementation of this program and increasing treatment and focusing on how we have to address the stigma around addiction and mental health, we were able to save over 3,000 lives in 3 years. As we think about collaborations going forward, we need to talk about the successes of programs like these. We also have to talk about what works. For example, having a single North Star, as we saw in the case of Be More for Healthy Babies, having everyone be focused on one single goal. Also, that it does require public-private collaborations and that there need to be both a long-term goal as well as short-term wins that one must show along the way. Another lesson learned through these collaborations is how we cannot let perfect be the enemy of the good. So often when we think about issues like public health, when everything is related to one thing, sometimes it can feel like, well, where do I even begin? If everything is related to everything else, what do I do? Well, there are simple steps that each of us can take today. If it's around COVID-19 or any other public health or healthcare issues that we face, don't let perfect be the enemy of the good. Be the person who steps up first. Let me then transition into the third section of this talk, which is what are the implications for the future of public health and healthcare? COVID-19, for better or for worse, has given us this opportunity to reimagine the future of healthcare. And there are some obvious changes that have already resulted. For example, telemedicine. As a practitioner of telemedicine for years, it's something that I've been a proponent for and I've been very excited that actually finally people are seeing the benefits of telemedicine, that it's a way to meet people where they are and to expand the opportunities for care. And I think we've seen now the benefit of telemedicine, and I think this is here to stay. Now, there are many opportunities for us to improve on the delivery of healthcare. We have to improve, for example, on the delivery of care when it comes to reimbursement, and ensuring that those who already are the least privileged are able to benefit from additional services like telemedicine. But I think there are real opportunities, for example, on making sure that we can finally integrate mental health and see mental health as just as critical a part of healthcare as we do physical health. Along these lines, I think there's also an opportunity for us to finally do something about healthcare disparities. These disparities, again, have existed long before coronavirus, but coronavirus has really brought them out into the open. And by the way, it's not only in adults that we're seeing these disparities. There's a tragic statistic among children who have died of COVID-19. 3/4 of children who have died from COVID-19 are Black and brown children. from the same communities that have hit their parents, their grandparents the hardest. They're also hitting our children the hardest as well. But I think there are real opportunities for us to address the disparities, both short-term and long-term. Short-term, for example, making sure that we're targeting testing, contact tracing in communities that are hit the hardest, making sure that we collect data around test positivity. For example, if we know that in a state, the test positivity rate is 5%, but we know that in certain communities, let's say that whites are testing at 3%, but Latino Americans are testing at 40%. It means that we need to be targeting testing, particularly to Latino communities in this particular state, and understanding also what are the barriers in place that's leading to this very high test positivity rate. Is it that we are only having drive-in testing, but many people don't have cars? Are there fears of immigration? Are there other access issues that we could be targeting as well? And then in addition to that, there are long-term issues that we can really focus on when it comes to these long-standing racial disparities as well. And then finally, the opportunity to reimagine the future of health and healthcare is paying attention to the social determinants of health, understanding that what determines how long and how well we live isn't just about literally the health care that we receive, but also about the air that we breathe, about the education that we have access to, about poverty, which also is a major contributor to poor health. And overall, there is an opportunity for us to rethink how we can make the future of our world more equal and more just for all. Let me end with a quote from my mentor, someone who has meant so much to me over the years and to so many Americans over the years, the late Congressman Elijah Cummings from Baltimore. Congressman Cummings used to say that our children are messengers to a future that we will never see. I think about this frequently as I think about my own two children. I have a toddler and a baby who's 6 months old. And I think about how the work that we have ahead of us is about our children. It's about the generations that are yet to come. And we now have a situation where someone lives determines whether they live. And we just cannot accept that geography is destiny. We should let COVID-19 be the loud clarion call to action for all of us to do our part and improve health and well-being for all.